How's it going, everybody? Bleam here from Freedom Chiropractic and Rehab. Today we're going to talk about one of the easiest things that you can learn how to do to prevent lower back pain. So the thing that we're going to talk about primarily is how we bend, right? We all tend to bend differently to pick things up from the floor, and what we want to do is practice bending one way and becoming proficient with that. So I'm going to ask Nicole to come in and join us. There's a weight on the floor here. I don't know if you'll be able to see it on the camera, but I'm going to ask Nicole to bend down as if she's going to pick up this weight. And this is the type of bend that we see from most of our patients. You can see that there's a rounding here of her back, right? We're seeing some rounding down here in the lumbar spine. So I'm gonna have Nicole stand up again. What we're gonna do now is use a dowel on her back to kind of simulate a straight back and what it would feel like if she kept those curves in their normal positioning. So we're gonna have a little bit of a curve in our cervical spine, we're gonna have a little bit of curve in the mid-back and the thoracic spine, and another curve in the lumbar spine, and we wanna preserve those curves as we bend. We don't wanna allow them to roll forward into that flexed posture that you just saw Nicole go into. So she's holding the spine or the dowel at her back, contacting her head, her mid-back, and on her sacrum, so in between her butt cheeks. And what we're gonna do is ask Nicole to practice bending at her hips. So most people, when they bend, they want to bend at the waist. We want to prevent that. You can see how the dowel comes off at her head and also at her sacrum. So as she stands up, what I'm going to have Nicole do first is just focus on bending your hips back. So we're going to slide the hips back. And you'll see here the dowel stays in contact at those 3 points. Have you stand back up again, Nicole? Now obviously that didn't wet her head to the floor. So what she's going to do next is she's going to bend her hips back, and then she's going to use her legs, her knees, and her hips to lower herself down to the weight as opposed to reaching for it. So you see the flex in her knees and the flex in her lower back. Okay, you can come on back up here, Nicole. Now what I'm going to do is take this dowel away from her, and I'm going to have her do the same thing again. She can use the wall here to give her some feedback and a target. So what she's going to do is slide the hips back and then bend the knees to touch her butt to the wall. This is very different if you watch me for a second. A lot of times people will bend at the knees first. Right? So you'll see those knees slide forward. If I have Nicole do that now, she will not be able to get her butt to the wall no matter how hard she tries. Right? We want to sit back, put our weight in our heels by sliding back and then bending our knees to tap the wall. Now, this is something we're going to use whenever we go to pick something up, but when else can we use this? How about when you brush your teeth, when you wash your face, when you wash your hands, when you wash dishes? Anytime we bend forward, it should be a hinge at the hips as opposed to a hinge at the waist, okay? So give this a shot. Keep practicing it. Use it throughout the day. The more you use that hip hinge movement, the better off you're going to be. Thank you very much for taking the time to watch the video. If you have any questions or we can help with anything at all, please don't hesitate to let us know. Thanks again, and we'll catch up with you again next week.